Director of Research at the Department of Family Medicine at Charles Drew University. He served as immediate past president of the Academic Center for 6 long years. Dr. Bazargan is a medical sociologist with extensive training in the fields of aging, research methodology, evaluations, and statistics. He received his Ph.D. in medical sociology from the State University of New York at Buffalo. He has been a member of this Charles Drew University faculty since 1993 and was previously on the faculty of Xavier University. Dr. Bazargan's research is related activities is concentrated around the health status and health disparities experienced by racial, ethnic minorities and socioeconomically disadvantaged populations. He has conducted several large population and community-based surveys on access and utilization of health services by underserved minority older adults. Dr. Bazargan has authored 101 scientific papers, many of which address access to care, barriers to medical care, use of health services, racial disparities, and health outcomes among older African Americans. During the last 10 years, he's been funded by several federal agencies, including the Center for Medicare and Medicaid Services, the National Institute of Minority Health and Health Disparities, the Administration for Children and Family Health, and the Health Resources and Service Administration to conduct research and interventional study among minority populations. We're very pleased to welcome Dr. Bazargan to give the opening introduction on today's topic of
Thank you, Dr.
diversity populations working with racial, ethnic, sexual, and gender minorities. Thank you, Dr. Bazargan.
Thank you. I appreciate your kind word, Dr. Friedman. As you mentioned, this is the second institute of SART. And what is quite important here, before I tell you who's the PI, is the multidisciplinary aspect of this training. We truly have more than 35 individuals from UCLA, CDU, and other institutions who are working together to provide this training. As I indicated, the principal investigator for this R25 grant is Dr. Friedman, which was funded recently for 5 years. And as you see, the project title is the Next Generation Substance Abuse Research Training at Charles Drew University of Medicine and Science and UCLA, that we briefly called it SART. So there are 3 main objectives of this project. The first one is to provide hypothesis-driven research opportunity to mostly undergraduate, master degree, master student, post-bac, and doctorate students, and to provide innovative, state-of-art courses. As I said, multidisciplinary, state-of-art courses for skill development to give trainees that they can get their feet wet and becoming, researcher in substance abuse area. So today, as part of our efforts, we have a number of distinguished speakers from both UCLA and CDU. The first presentation will be by Dr. Kenneth Wells and Dr. Booker, entitled Principles and Guideline of Community Engagement. They are going to answer 3 main questions. Why community partner participatory research is important. They briefly review the principle and 101 of the CPPR, and they provide a specific example that focus on depression. And they review the lesson learned and a strategy that they used for this very important study that Dr. Wells conducted for many years at underserved community. So we are quite delighted to have this distinguished, well-established, internationally known individuals, Dr. Wells, on issues related to community participatory research. And then we will go on. This is quite interesting for those of you who are participating in this program for the first time. Charles Ardrou University of Medicine is one of the institutions in the United States, probably one and the only one, who has community faculty. So we have 15 community faculty that they are all recruited from community. They are advocates, CEO, or from different organization, community-based organization that they have trained to be the faculty at CDU, and they provide all kind of support when we would like to conduct research in our community, underserved community. So today, you are going to hear from 4 of those community faculty that they focus on how to connect community-based research to public policy making process. They talk about community participatory research from community perception and perspective. And the other topic that they will cover, engaging the community in research and education. They provide some example and plans with CPPR. In a nutshell, this is very unique that probably you do not find it anywhere, because it is quite good and valuable that people from academic discipline come to you and explain the principle of community-based participatory research. But this time you hear from community leaders, community advocates, those individuals who are helping us to understand community and what they need and how we need to approach them. So I'm very excited about this presentation that you will hear soon. Then one of the very important aspects of writing a grant, writing a proposal, is design of the study. We have a distinguished professor from UCLA, CDU, and the VA institution, Dr. Martin Lee, which will talk about how to design and implement a clinical trial in community setting. He will talk to you about difficulties that, and challenges that we have for designing a randomized clinical trial in community. So not only Dr. Lee will talk about design of randomized clinical trial, he also talks about sample size consideration, how to calculate the sample size, what kind of sample do you need, because again, when you're talking about community-based clinical trial, then the issue and challenges are quite different than when you recruit your participants from clinic. So he will talk about basic parameter of sample size calculation, research design, and also he will briefly talk about different type of software that we need to do. At noon, we have a very distinguished faculty from Charles Drew University who recently were recruited from University of Michigan, Ann Arbor, University of Michigan, Dr. Sherwin Asari, Associate Professor and faculty at Charles Drew University. He is one of the very unique individuals that for his entire career focused on discrimination, racism, and structural racism. He is the one who put together a very interesting theoretical framework called MDR, which stands for diminished return, marginalization related diminished return. This individual has close to 400 publications and nationally known for his research on racism and discrimination. So he will, at noon, he will provide this extensive lecture that I encourage you to participate and listen to his presentation. And then he will talk also about working with racial, ethnic, and sexual and gender minority following his noon presentation after break. So we are going to have another distinguished researcher from UCLA who will talk about 101 of participatory health information science and its use in CBPR. Finally, Dr. Cobb, Ph.D. And from a School of Nursing at Charles Drew University of Medicine, and myself will give you an example of our research work, which was funded by NIMHD. We focus on how to develop a research agenda and proposal working with community from scratch. So how we get together with community faculty, community advocate, church leaders in South Central LA to develop a proposal for reducing the risk of COVID-19 in South Central LA. So with this, let me stop sharing this with you and just encourage all of you to actively participate in our presentation and workshop today, and looking forward to work with all of you. And Dr. Friedman probably tell you that we are all available to answer your question. You have our contact number, you have our email, and please don't hesitate to contact us and let us know if there is anything that we can help you. So with this, I will ask Dr. Booker to introduce our first presenter, Dr. Kenneth Wells. I don't know if he is here or not. If Dr. Booker?
I'm here.
Dr.